When you think about health, what comes to mind? Maybe it's doctors or medicine, gym sessions, and self-care routines, or maybe all of the above. But what if health is shaped by more than just our choices? What if it's influenced by the world around us? In the air we breathe, the water we drink, the land we walk on, the food we grow. What if health begins in the environment that surrounds us, in the places we call home? Hi, my name is Emily Dang, and I'm a public health student studying at the University of Waterloo. This summer, through the Queen Elizabeth Scholarship, I traveled to Ghana to study some of the most pressing environmental issues, from climate change, water insecurity, and plastic pollution. Throughout this course, we've explored how environmental issues intersect with everything from gender, socioeconomics, to politics. We spent the first month at the University of Cape Coast and the second at Ashesi University, where this week we focused our learning on the health dimensions, exploring how the climate we live in, the resources we depend on, and the systems we interact with shape our health in ways that we aren't always aware of. To understand these dimensions, we need to ask, what is health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease. While complete may be unrealistic for some, this definition pushes us beyond a biomedical model, encouraging a holistic view, incorporating the physical, mental, and social well-being. However, health isn't static. It's shaped by beliefs, lived experiences, and systems around us. So I asked the question to both Waterloo and Ashesi students, what does health mean to you?
I feel that health encompasses so many aspects of our life and dictates how much capacity we have when we're able to do a bunch of different things.
Health to me means having a balanced state of being, not just physically, but also mentally and emotionally. It means being able to feel good, having a peace of mind, and doing what you love without any limitation.
It means that it's a priority. It comes before anything we really do, before school, before work.
Health is fitness in both the mind and body.
Functionality.
Physical and mental well-being.
Equal access and opportunity.
Peace of mind. Not dying.
Everything and nothing.
Fragile, but it's also a lifestyle.
Important. Neglected.
In mentally, physically, spiritually, and socially well.
Balance.
Psychological and physical.
Constantly changing.
Self-care. Physical and emotional well-being.
Honest.
Health is everything around us.
To make sense of people's experiences of health and different ways of knowing, we turn to three key theories we've explored throughout the course: the social determinants of health, ecosocial theory, the One Health approach. The social determinants of health refer to the external conditions in which people are born, grow, work, live, and age. Determinants include healthcare, education, income, infrastructure, and social networks. They also encompass people's access to power, money, and resources, and these determinants are complex and interact at different scales to influence and shape someone's life, including the micro, meso, and macro level. In public health, this concept is often used to help illustrate and dissect why some health disparities are simply not because of personal choices, but rooted in social and structural systems people are born into. Next is the ecosocial theory developed by Nancy Krieger. This theory introduces the idea of embodiment, where our bodies are essentially everything that surrounds us in the world. From utero until we die, we biologically incorporate the material and social conditions we live through. Krieger highlights that our bodies tell stories that cannot be separated from our existence and reveals hidden stories we can't or choose not to tell. This theory goes beyond individual behaviors and health, making us think about the social and environmental conditions that get under our skin, shaping us at every level. Lastly, One Health is a unifying concept that recognizes the health of humans, animals, and the environment are closely interlinked. This approach brings together multiple sectors, including doctors and nurses through humans, veterinarians and agriculture workers through environment, and ecologists and wildlife specialists through animals. One Health can be used to address complex issues like managing zoonotic diseases, protecting global health security, biodiversity, and conservation, highlighting the need that in order to protect health, you need to protect the entire ecosystem. Through field activities, conversations with locals, and classroom lessons, we explored how health can be shaped by Ghana's natural, built, and social environments. The natural environment refers to air, water, and land. Geographically, Ghana is located along the Gulf of Guinea in West Africa and is ecologically diverse, with the forest covering southwest regions and the savanna across the north. Ghana is considered a climate-sensitive country, experiencing altered rainfall patterns, sea level rise, flooding, and droughts, not only impacting their ecosystems, but people's lives and well-being. During our first week in Ghana, we visited a coastal community in Moray near Cape Coast. There, we spoke with local fishers who shared how coastal erosion and rising seas have impacted their community, destroying homes and threatening their safety. Some spoke of climate stress not solely because of the physical damage that they've experienced, but the emotional toll of seeing their livelihoods disappearing into the sea. Changing weather has also altered fish migration patterns, making it more difficult to have a stable income. And while some want to relocate, barriers like finance, available land, and government assistance prevents them from doing so. And applying the social determinants of health lens, climate change and natural systems shape health, intersecting with dimensions like infrastructure, income, and housing. What we saw in Moray was a reminder that health is not only biological, but the external environmental conditions people have to navigate every day. Next, the built environment refers to human-made structures like homes, roads, and water systems. Throughout the course, one area we have explored is water insecurity, which remains a global challenge, especially in regions across sub-Saharan Africa. Drivers include poor infrastructure, lack of investment, and/or inaccessible water services. According to the 2021 Ghana Population and Housing Census, rural communities rely more on pipeborne, boreholes, or surface water, while urban areas are more likely to use sachet water or pipeborne, signifying a difference in access. During our first month, we were placed with a local NGO where I worked with PHE Link, whose mission is to address public health risks that stem from the environment. For one of our visits, we traveled to Onlo Beach to hear directly from the chief and the residences about their experience with ongoing water challenges. Many in the community relied on unprotected water sources like hand-dug wells that tap into surface water. However, with rising sea levels, this has caused saltwater intrusion, and with few alternatives, they continue to utilize this water despite reports of high blood pressure, typhoid, and stress. And when these wells run dry, women and girls are forced to travel long distances at odd hours in search of other sources. We can turn to ecosocial theory to remind us that our bodies observe and reflect the conditions of our surroundings. In seeing Onlo Beach, it's clear the material environment, such as the lack of safe water infrastructure, can become embodied through stress, hypertension, and disease. Finally, the social environment refers to the cultural, economic, and societal systems. In Ghana, plastic pollution has become embedded into daily life for hygiene, convenience, and affordability. As reported in the same census, the main sources of drinking water in more than 50% of urban areas are sachet water. Sachet waters are made from low-density plastics that hold water within them, and with the constant use of plastics coupled with improper disposal, plastics have increasingly become a burden in Ghana. During one of our field activities, we dissected fish from a local market alongside Dr. Shika, a professor at UCC from the Department of Fisheries and Aquatics. Using various lab techniques, we are looking for microplastics, which are tiny fragments of plastics that are less than 5 millimeters in size. Fish can sometimes mistake the plastics for food, leading to bioaccumulation, and then when humans consume the fish, there is a risk of transferring the plastics into us. Applying a One Health approach helps us understand how social habits and poor waste management can impact the food chain, ultimately circling back to impact our own health. Addressing complex environmental issues like plastic pollution requires collaboration from all sectors, from environment, animals, and humans. Now that we understand a bit more of the health dimensions of environmental issues in Ghana, what can we do and how can we move forward? Understanding and addressing the health dimensions of environmental issues is not just a local concern, but a global health challenge. From climate change to water insecurity to plastic pollution, these are shared problems that transcend borders. And global health is not a discipline, but rather a collection of problems that demand coordination and transdisciplinary action. To explore a little bit more about global health, this week we had the opportunity to visit the WHO country office in Ghana, where we spoke to the WHO officers and learned more about the Ghana Country Cooperation Strategy. This strategy followed the global frameworks focusing initiatives on 3 priorities: achieving universal healthcare access, strengthening emergency preparedness, and addressing the social determinants of health. One unique project that the WHO in Ghana is supporting is the Fostering Reforestation, Environmental Sustainability, and Tourism in Okimen area in Ghana. This is a 3-year multi-partnership program across different UN agencies who are working together to strengthen local systems through addressing gaps in environment, health, and education. This visit emphasized the importance of global governance and the need for collaboration across partnerships to achieve their role in promoting health and well-being for all. As learned through the different theories, health is more than just responding to disease, but it's about working together to safeguard health and strengthen systems around the environments that are around us. Health and the environment do not exist in isolation, as health and well-being exist within our bodies, but also across space, time, and place. Where we live shapes how we live. The space around us influences what we're exposed to, what we have access to, and how we navigate through our lives. In many ways, where you are determines who you are. Now, I asked some Waterloo students what were their biggest takeaways since being in Ghana understanding environmental health.
Since being in Ghana, I've learned a lot more about how people's health are impacted by the environment, especially different demographics of people. So depending on where you are physically located, your age, your gender, your race, your socioeconomic background, it's different for everyone, and it's really important to pay attention to those differences because everyone's struggling with something different.
I think the biggest perspective change has been seeing how environmental health is directly related to the most basic foundational needs of human health.
As highlighted, humans shape the environment as much as the environment shapes us. In order to be true global citizens, we need to recognize how our actions, choices, and systems impact health across the world.